Former Chief Medical Officer Dr. Patrick Martin believes that the COVID-19 task force will have to communicate in a timely manner important developments as it relates to the management of the pandemic in St. Kitts and Nevis. Dr. Martin was referring to a recent quarantine breach which resulted in the release of a person who had tested positive for COVID-19. That eventually led to some 20 persons being quarantined after contact tracing. The announcement of this breach was made almost a week after the incident occurred by Superintendent of Police Cromwell Henry at the NEOC weekly press briefings. For Dr. Martin, this should have been announced much earlier, considering the potential health risks to the country.
Well, fortunately for us, the breach did not escalate the community spread. That was the fear, real fear, several days after it became known. My concern is about the timeliness and the thoroughness of communication. I compare the NEOC communication with that from National Bank. In my mind, National Bank came out very early and put out something we can sink our teeth into, namely, our money is safe. They knew what happened, they're working to correct it. The NEOC, on the other hand, took several days to tell us about the breach, and in so doing used the term lapse, which seemed to indicate a lesser mortal than breach. But eventually the word breach became part of the NEOC's vernacular. The CMO used it in her report to Cabinet, and on February 10th, NEOC report mentioned breach.
However, Chief of Staff at the JNF Hospital, Dr. Cameron Wilkinson, when asked by SK Newsline last week about the timeliness of information relating to the quarantine breach, he said the necessary investigation has to be conducted first before an announcement could be made.
When there is a breach in quarantine that is identified, the first thing that the task force does is not to run to the mic and announce it, but we run to the place where the breach was identified and put measures in place to contain the breach. We do an extensive contact tracing to make sure that we identify anyone and everyone who would have been potentially exposed, to make sure that we contain the virus. And it is because of the diligence and the quick action of the task force over the last 12 months in managing this pandemic why we have not had any community spread to date. We, however, inform you in a timely manner. Initially, at the start of the pandemic, we had these briefings on a daily basis. We now have them weekly, and we attempt to inform you in a timely manner whenever there is a breach and what was done to contain the breach.
Meanwhile, Dr. Martin said the COVID-19 task force should implement a crisis communication plan as part of its effort in keeping the Federation safe.
There is a discipline called crisis and emergency risk communication. This is a field of endeavor. One has to be trained in it, including government ministers, public health officials, police, security forces officials, disaster officials. One has to be trained in it. The it is crisis and emergency risk communication. Subject to the inculcation of that training, public messages would likely be simple, timely, accurate, relevant, and consistent.
I'm Andre Huey for SKN Newsline.